I'm going to talk about the antidepressant Wellbutrin, which goes by the generic name of bupropion. So what is Wellbutrin good for? Well, Wellbutrin blocks the reuptake of norepinephrine, which is noradrenaline, and dopamine. It's not a stimulant, but it is related to the amphetamines structurally, and it has stimulant-like properties. It's very activating. And so it increases energy. It wakes you up. It motivates you. It gives you motivation. It helps get you out of bed. So it's good for those depressions that are characterized by psychomotor retardation, when you're slow, you don't have any energy, hypersomnolence, you're sleeping too much, you want to stay in bed all day, you don't even want to get out of bed, you're procrastinating a lot, not getting your stuff done. Perhaps you're having cognitive symptoms. Wellbutrin is very good for improving concentration and short-term memory. As a matter of fact, it is an alternate non-stimulant treatment for ADD and ADHD, attention deficit disorder, and the related syndromes. Even if you don't have ADD, if you're having a lot of those symptoms where you can't concentrate, you're distracted, and you're unmotivated, Wellbutrin is a good choice because it increases those neurotransmitters that in the brain help those specific target symptoms. So whether you can't focus and you're unmotivated and you're procrastinating because you have ADD, or whether you're having all of those symptoms and doing those things because you have major depression, either of those syndromes can cause those symptoms. But if we've identified the symptoms, which are easier to identify than making that diagnosis, then you can't really go wrong using Wellbutrin as long as you understand what the potential side effects are. Wellbutrin is also good for anhedonia. Anhedonia means that you're not looking forward to anything. Nothing excites you. It's a lack of pleasure. It's the opposite of hedonism. And so you don't find pleasure in anything. A lot of times that's reflected in a lack of appetite. You don't enjoy food, or loss of libido, sexual desire is reduced. And in fact, Wellbutrin is a good treatment for low sex drive in a lot of people because it increases dopamine. And dopamine is the neurotransmitter that is involved in the pleasure pathways, the reward pathways. What are some of the side effects from Wellbutrin? Wellbutrin can make irritability worse. It can make anxiety worse. It can give you a panic attack if you're prone to that. That's not too common, but if a person is prone to it, and in the extreme, it can cause seizures. And you have to be very careful when you dose it because there is a warning about a seizure threshold. In overdose, it can be lethal, but that's rare. It also causes dry mouth, constipation, increased sweating, especially on exertion. And all of this is because of the adrenaline, right? The noradrenaline, the norepinephrine that you're increasing, and the effect that has. It also can cause weight loss. It's, for the most part, weight neutral. Most people don't lose weight on Wellbutrin, but they don't gain weight. And so it's one antidepressant that can be used where you really don't have to worry about weight gain. It can cause jaw clenching. It can exacerbate tics, especially when the medication is waning. Like stimulants, a person who is prone to tics, such as nail biting or hair pulling or picking at their skin, or those sorts of tics, can get worse as the medication is wearing off toward the end of the day. And people that have OCD, obsessive compulsive disorder, can also notice that that's worse with a stimulant, that they're more obsessive. For example, the phenomenon of getting stuck on a song and you got a song playing in your head, it won't stop. That can happen to people who are prone to it when they take stimulants and when they take Wellbutrin, the non-stimulant Wellbutrin, because at the end of the day, both stimulants and Wellbutrin increase dopamine and norepinephrine, and that it's just a matter of degree. And so You can have worsening of obsessive symptoms and compulsive symptoms. People that may feel more impulsive as well. And so certain disorders like gambling addiction, which is known to get worse with stimulants in some people with gambling disorder that are prone to that, can also happen with Wellbutrin. Also, we have to be careful about the blood pressure. Blood pressure can be increased by medications that increase noradrenaline because that causes vasoconstriction and in the peripheral vascular system, and that increases blood pressure. It's not necessarily going to give you hypertension, but it does need to be monitored. It works quickly. We always say that you have to wait several weeks before you get the full effect of an antidepressant, but antidepressants really start to work fairly quickly, and Wellbutrin, you really get the effects within days of starting it. And things get better. Patients with endogenous major depressive disorder can take several weeks before they start to feel better. But if you give it to someone with an adjustment disorder or someone with less severe symptoms, they can really start to perk up in a day or two. And the side effects as well are immediate. Patients will start to feel the dry mouth and headache or the constipation or whatever they're going to have, if they're going to have it, early on. You give it to those patients who are slowed down, who are having trouble concentrating, who are sleeping too much, who don't find pleasure, don't get excited about things, and who are procrastinating. These are some of the symptoms that Wellbutrin is very good for. And it can be used in combination with other medications to treat other symptoms. You don't want to give it to the patient who's agitated. You don't want to give it to the person who is anxious, who can't sleep, who is obsessing, they can't stop thinking, they can't shut their mind off. You don't want to give it to the patient who's got a lot of irritability with impaired frustration tolerance, or to the individual whose depression is characterized by a lot of anger. Wellbutrin is not going to help any of that. It can make it worse, and probably will make those things worse. Also, if you're trying to treat crying jags, if you've got a patient who can't stop crying and whose tearfulness is it's not working, it's not making them feel any better after they cry, then you want to use a serotonergic agent. You want to use an SSRI or an SNRI, medications that block the reuptake of serotonin so that those people can calm down. And you can watch my videos on Prozac and Paxil and Zoloft and that family of quote-unquote antidepressants to learn more about the actions of serotonin. And Wellbutrin can also be used to treat smoking cessation. So in addition to helping with depression, in addition to improving sexual dysfunction, whether that's caused by a medication or not, and in addition to being good for ADD type symptoms, it also can be used to help nicotine craving and tobacco addiction.